Imagine your body is a deeply integrated smart house, right?
Okay, I like that analogy.
But the central computer has been secretly infected with malware. So the air conditioning, the heater, the security alarms, and the plumbing, they are all suddenly fighting each other.
Oh, wow. Yeah, total chaos.
Exactly. You're drowning in a flood on the ground floor, but your internal sensors are screaming that you're actually dying of thirst.
Which is a terrifying situation to be in.
It really is. And today, for all of you listening, we're doing a deep dive into exactly that kind of scenario. We're looking at what happens when the kidneys fail.
Right. Because usually when people talk about chronic kidney disease or CKD and hemodialysis, the standard view is pretty well mechanical.
Yeah, we tend to treat the kidneys like biological plumbing, right? Just simple water filters.
Exactly. But the sources we're unpacking today really challenge that idea.
We've got a fascinating stack of research for you today. We're pulling from clinical studies out of Morocco, Iran, and Europe, plus some qualitative research on immigrant populations in the U.S., and medical guidelines from UpToDate and the NHS.
It's a really comprehensive look at the issue.
And the mission for this deep dive is to explore how kidney failure doesn't just affect a pair of bean-shaped organs. It radically and systemically alters the entire human body.
Yeah, it completely changes the patient's lived experience. The kidneys are essentially the chemical conductors of the body's entire orchestra.
I love that. So when they go offline, the music doesn't just fade, right?
Right. Every single instrument starts playing out of tune.
Mm-hmm.
And knowledge about this disease is most valuable when we look at the system as a whole.
Which is why we brought you here, to help us understand the specific mechanisms.
Well, I'll do my best. We really need to look at why these systemic changes happen and what they actually mean for the human being trapped in that failing smart house.
So let's jump straight into the internal chaos. We have these invisible systems that just go haywire when kidney function drops.
Specifically, the nervous system and fluid management.
Yeah, so when those toxins build up because the kidneys aren't filtering them, how does that actually dismantle the body's internal network?
Well, the primary mechanism here is that the uremic toxins directly damage the autonomic nervous system. It's called autonomic neuropathy.
Autonomic meaning the automatic stuff.
Exactly. It's the background operating system running your heart rate, your digestion, your blood vessels.
The stuff you don't even think about.
Right. And as uremic toxins accumulate in the blood, they interfere with nerve conduction. The physical nerves themselves degrade.
So the background apps just start crashing.
That's a great way to put it, yes.
If the background apps start crashing, what does that look like in real time for a patient?
It creates unpredictable systemic chaos. I mean, a patient might just stand up from a chair, and because the nerves controlling the blood vessels don't send the signal to constrict, their blood pressure plummets instantly.
Oh, wow. So they just get dizzy or pass out?
Yeah, they can easily collapse.
Mhm.
Or consider hypoglycemia.
Low blood sugar.
Right. If you have low blood sugar, your autonomic nervous system normally triggers a stress response. You get shaky, you start sweating, you feel this urgent need to eat.
Like an alarm bell going off.
Exactly. But autonomic neuropathy basically cuts the wire to that alarm system.
Wait, really?
Yeah. A patient's blood sugar can drop to dangerously low levels, and their body gives them absolutely no physical warning.
That is terrifying. You're just flying blind in your own body.
Completely. And it even extends to things you wouldn't associate with kidneys, like your vision.
Vision.
Mm-hmm.
How does kidney failure affect your eyes?
Well, the autonomic nerves control your pupillary response. So in advanced CKD, that response becomes really sluggish.
So they don't react to light properly.
Exactly. If a patient is driving at night and an oncoming car has bright headlights, their pupils can't constrict fast enough.
Oh, man. So they get blinded.
Right. And then, when the car passes, they can't dilate fast enough to see the dark road again. It's disorienting and incredibly dangerous.
And what about digestion? If the nerves are failing everywhere, the stomach has to be affected too, right?
Oh, absolutely. It essentially paralyzes the stomach. It's a condition called gastroparesis.
Meaning the stomach just stops working.
Pretty much. The digestive tract relies on coordinated automatic nerve signals to push food through. When those signals fail, the food just sits there.
That seems awful.
It is. Patients feel painfully full after eating just a few bites. They suffer from severe intractable nausea and heartburn because the stomach just isn't emptying properly.
Which brings us to the most baffling part of this systemic failure for me, the fluid paradox.
Ah, yes, the cruelest reality of hemodialysis.
Right, because the kidneys aren't making urine, the patient's body is physically waterlogged. They are retaining massive amounts of fluid.
They're completely overloaded.
But at the exact same time, they're suffering from agonizing dry mouth and a feeling of intense, unquenchable thirst. How does the body even survive when its core automated systems are sending completely contradictory signals?
It's so hard on them. The dialysis machine is designed to pull fluid out of the blood compartment. But the body's osmolality sensors, the parts of the brain that monitor fluid and concentration, they get thoroughly confused.
Confused by what? The toxins?
Yeah, the high levels of uremic toxins and the rapid fluid shifts during treatment. The brain detects that fluid is being drained from the blood vessels and screams that the body is dehydrated.
Even though the surrounding tissues are completely flooded with excess water.
Exactly.
So they're walking around with excess fluid, but they literally feel like they are wandering through a desert.
And it's not just a feeling. It is a physical reality in their mouth. Saliva production can drop below 0.1 milliliters per minute.
That's basically nothing.
It is nothing. And if you think about the mechanics of that, saliva is necessary to wash away bacteria, neutralize acids, lubricate the tissues.
So without it, their mouth is just unprotected.
Right. The tongue becomes this sticky, painful surface. Patients develop massive dental decay, severe inflammation in the entire mouth lining. And this constant lack of moisture only amplifies that baseline nausea we just talked about.
Okay, so the doctors have to restrict the patient's fluid intake so they don't overload their heart and lungs. But the patient is in agony wanting a glass of water.
It's a constant battle.
So if the body's internal gauges are completely broken, how do doctors even figure out how much fluid to actually remove during dialysis?
It's a delicate balance.
Because if they pull too much, the patient's blood pressure crashes. Right. But if they don't pull enough, the patient drowns in their own fluid.
Exactly. So they've actually had to bypass the body's broken sensors entirely. They use a technique called point-of-care ultrasound, or POCUS.
Oh, so they're using imaging.
Yeah. Instead of just putting a patient on a scale and guessing their dry weight, which is their ideal weight without the excess fluid, clinicians use ultrasound to physically look inside two different compartments in real time.
So, using our house analogy, they're looking at the pipes and they're looking at the walls outside the pipes.
That's a perfect way to visualize it. First, they scan the lungs. They're looking for something called B-lines.
B-lines, what are those?
Well, when fluid leaks out of the blood vessels and accumulates in the interstitium, which is the tissue of the lungs, the ultrasound waves hit that trapped water and create a specific reverberation artifact on the screen.
Oh, I see. What does it look like?
It basically looks like a laser beam shooting down. Counting those B-lines tells the doctor exactly how much extravascular water is trapped in the tissue.
And then they check the pipes themselves.
Right. They move the ultrasound probe down to the inferior vena cava, which is the massive vein returning blood to the heart.
And what are they looking for there?
They watch how that vein expands and collapses as the patient breathes. If the vein is really plump and doesn't collapse much, it means the intravascular volume, the fluid inside the vessels, is too high.
Oh, so by integrating both the lung scan and the vein scan, they get a highly accurate map of the fluid.
Exactly. They can pinpoint the exact dry weight safely without relying on the patient's compromised internal sensors.
That is incredible. But, okay, if the kidneys can't clear these toxins and the internal systems are essentially drowning in them, that toxic waste has to go somewhere, right?
It does. It pushes outward.
Which brings us to the skin. The internal chaos actually breaches the surface.
Yeah, because those uremic toxins are accumulating in the bloodstream with nowhere to go, they severely alter the skin's barrier function.
So it's not just a superficial thing.
No, it's not just a side effect. It is a profound structural breakdown of the skin itself.
Yeah.
One of our sources, a study from a hospital in Gelmim, Morocco, looked at a cohort of hemodialysis patients.
And what did they find?
Every single one of them, 100%, had dermatological abnormalities.
Wait, literally 100%?
100%.
That's wild. So the skin is basically acting as a secondary diagnostic window for the failed kidneys. But we're not just talking about dry skin like you get in the winter, right?
Mm-hmm.
What is actually happening to the structure of the skin?
The anatomy of the skin fundamentally changes. The sebaceous glands, which are the ones responsible for producing the oil that protects your skin and keeps it supple, they literally atrophy.
They just shrink and die.
They shrink and die off, yeah.
So the body just stops producing its own moisturizer entirely.
Exactly. The protective lipid film on the surface just vanishes. The outer layer of the skin becomes intensely dehydrated and brittle.
That sounds incredibly uncomfortable.
It is. And the consequence of that anatomical failure is severe continuous itching. It's called pruritus.
Oh, I've heard of that.
Yeah.
Is it like a normal itch?
Not at all. It's a deep systemic itch triggered by the nerve endings firing in that dry, toxic environment. And it is notoriously worse at night.
Oh man, so they can't even sleep.
Right. The sleep deprivation that comes from not being able to stop scratching is a massive blow to the patient's quality of life.
I can't even imagine. And the sources mention changes in pigmentation as well. Why would kidney failure change the color of a patient's skin?
It all comes back to the kidney's role as the chemical conductor. There's a hormone called melanostimulant that triggers pigment production.
Okay. And a healthy kidney would normally clear that out?
Exactly. It continuously clears it out of the bloodstream. So when the kidneys fail, that hormone just builds up to abnormal levels, circulating endlessly and overstimulating the pigment cells.
Wow. So they get hyperpigmentation from that.
Yes. Hyperpigmentation, along with diffuse hair loss because of the dying sebaceous glands, and widespread structural nail disorders.
So you really can't just throw standard over-the-counter moisturizer at a structural failure like that.
You really can't. Treating this requires a systemic approach. First, you have to optimize the dialysis procedure itself to try and pull more of those specific toxins out of the blood.
Get the root cause as much as possible.
Right. But at the same time, you have to aggressively, manually repair that physical barrier. Dermatologists use specific emollients, like creams containing highly effective humectants like glycerol and occlusives like paraffin.
So they don't just add moisture, they lock it in.
Precisely. They sit on top of the skin to physically trap water inside the tissue, acting as a synthetic replacement for the lipid film the body can no longer produce.
Wow. And as those toxins push outward, they are also infiltrating the endocrine system, right? Let's look at how this systemic takeover dismantles the body's hormones, because this impacts a patient's intimate life in ways that honestly rarely get discussed.
Yeah, the hormonal disruption is devastating. If we look at women with advanced CKD, their blood tests frequently show massive surges in a hormone called prolactin.
Wait, prolactin is the hormone responsible for breast milk production. Why is that surging if they aren't pregnant?
There are two main reasons. First, just like the melanostimulant we just talked about, the failing kidneys can no longer filter prolactin out of the blood, so it accumulates.
Makes sense. And the second reason?
The uremic environment itself actually causes the body to hypersecrete it.
Oh, wow. So they're producing more of it and clearing less of it.
Exactly. And this leads to galactorrhea, which is the inappropriate production of breast milk. But the systemic damage goes so much deeper than that.
How so?
That massive, unnatural spike in prolactin travels to the brain and severely impairs the hypothalamic pituitary axis.
Which is basically the command center for the reproductive system.
Yes. The brain simply stops sending the signals to the ovaries to maintain a normal cycle.
So their periods just stop entirely.
They stop entirely. They start releasing eggs. It induces a state of severe hypogonadism.
Man, if a patient in this state wants to have a child, what are her options even?
It's very difficult. The risks of pregnancy with advanced CKD are astronomical. You're looking at severe preeclampsia, catastrophic damage to whatever residual kidney function is left.
So is it impossible?
Not impossible. The data shows that if a woman is transitioned to intense, very long hemodialysis sessions, upwards of 16 to 24 hours a week on the machine, it pulls enough toxins out to clear that hormonal blockage.
Wow, 24 hours a week just to clear the blockage.
Yeah, and that significantly improves her chances of a successful pregnancy. They also have to aggressively treat the severe anemia that comes with CKD using synthetic hormones, which helps coax the endocrine system back online.
Wait, but look at what we're doing here. We're obsessing over fluid levels and B-lines and tweaking the hours on a dialysis machine to force a biological function. But what about the actual human being experiencing this?
That is the big question.
Because if the endocrine system is crashing and the skin is itching and they are exhausted, it feels like we're completely ignoring how this disease systematically dismantles a patient's intimacy and self-image.
And that is exactly where the purely clinical view often fails the patient. An Iranian study in our sources looked at hemodialysis patients and found that 100% of the women studied had some form of sexual dysfunction.
100% again.
Yes, particularly a total loss of desire and arousal. And for the men, over 84% experienced profound sexual dysfunction.
Mostly erectile issues.
Primarily erectile impotence, yeah, and a complete absence of spontaneous sexual thoughts.
That is a total collapse of a fundamental part of the human experience. Why is it so universal among these patients?
It's the ultimate collision of the physiological and the psychological.
Right, because physiologically, you have the crashed hormones.
You have the crashed hormones, widespread vascular disease restricting blood flow, and the nerve damage from the autonomic neuropathy making arousal physically impossible.
But you said psychological too.
Yes, the psychological devastation is just as potent. Imagine the loss of body image. These patients often have thick, scarred fistulas bulging in their arms or large plastic catheters embedded in their chests.
Not to mention they are tethered to a machine for hours a week, leaving them completely drained of energy.
Exactly. The sheer fatigue of the treatment, combined with the clinical depression that naturally follows the grief of losing an organ, it just creates a perfect storm. It dismantles their ability to be intimate, not just physically, but emotionally.
Which brings us to the macro level. We've seen how the internal organs fail, how the skin fails, how intimacy fails. Now let's look at how chronic kidney disease systemically alters a patient's entire psychological and sociocultural ecosystem.
This is a crucial part of the puzzle.
Let's talk about the qualitative data regarding older immigrant adults in the U.S. facing end-stage renal disease.
This research is critical because it highlights how vulnerable populations absorb this massive systemic shock. For older immigrants, the medical system itself often becomes a hostile environment.
Right, because they are navigating extreme fatigue and cognitive fog from the uremic toxins, while simultaneously dealing with language barriers.
Language barriers, structural discrimination, and a complete lack of familiarity with their rights in the healthcare system.
The sources single out undocumented immigrants in particular. What is their trajectory when their kidneys start to fail?
Well, because they lack insurance and fear deportation, they almost universally delay care. They don't see a nephrologist in stage 3 or 4.
So they just wait until it's an emergency.
Unfortunately, yes. They wait until they are in end-stage renal disease, actively dying from uremia or fluid overload, and they just crash into the emergency room.
And because it's an emergency, the treatment options change entirely, don't they?
Drastically.
Mm.
A planned dialysis patient gets an arteriovenous or AV fistula.
That's the one in the arm, right?
Yes. A surgeon connects an artery to a vein in the arm months in advance. That allows the vein to toughen up so it can safely handle the high pressure of the dialysis machine. It's relatively safe and has a low infection rate.
But an undocumented patient crashing in the ER doesn't have months.
Exactly. They need life support immediately, so they have to have a central venous catheter thrust directly into a major vein in their neck or chest. This tube goes straight to the heart.
That sounds incredibly dangerous.
It is a massive high-risk pathway for blood infections, and it just skyrockets their mortality rate.
Even for patients who are fully integrated into the system, the culture clash is profound. Like, the sources highlight the tension with Muslim patients wanting to fast during Ramadan.
It perfectly illustrates the limits of purely clinical medicine. From a strictly biological standpoint, a patient on dialysis fasting all day is incredibly dangerous.
Because of the fluid restrictions?
Fluid restrictions and complex medication schedules, yeah. Dehydration can clot their fistula, and then sudden fluid intake after sunset can overload their heart.
But just handing them a clinical directive telling them they aren't allowed to fast ignores their entire spiritual identity.
Precisely. If the medical system simply forbids it, the patient feels spiritually isolated. Or worse, they fast secretly and put themselves in extreme danger.
So what's the solution there?
It requires a negotiated, culturally sensitive approach. The care team really has to sit down, understand that the patient's spiritual survival is just as important to them as their physical survival.
So they work with them instead of against them.
Right. They find ways to adjust dialysis schedules and medications to support them safely.
And the psychological toll of this sudden dependency just changes their role in their family and society. The research noted that in cultures where aging is associated with respect and being a caregiver, suddenly needing help just to stand up after dialysis brings this deep sense of humiliation.
The loss of identity is staggering. The studies recount patients who were high-level executives traveling the world, or physicians running their own practices.
And then it's just gone.
Just gone. Suddenly an acute event happens. And the sources actually specifically highlight severe COVID-19 infections as a modern trigger for this.
Oh, really? COVID can trigger kidney failure?
Yes. A patient gets a severe COVID infection. The systemic inflammation causes massive acute kidney injury. The delicate nephrons in the kidneys scar over, and it rapidly progresses to irreversible CKD.
So they go from completely healthy and independent to being tethered to a machine literally overnight.
Overnight. And the crushing physical fatigue of the disease steals their ability to work, to volunteer, to maintain their place in their community. Their entire identity just becomes dialysis patient.
We talk so much in Western medicine about shared decision-making and patient autonomy. But if a patient is dealing with cognitive impairment from toxic blood, extreme exhaustion, a language barrier, and the absolute trauma of losing their career and identity, what does informed consent actually mean?
It's a really difficult question.
We demand they act like autonomous consumers of healthcare, but we've placed them in an ecosystem they didn't choose with a brain that is literally being poisoned by their own blood.
It exposes a massive flaw in how we deliver care. True shared decision-making can't just be handing a fatigued, uremic patient a pamphlet of statistics and asking them to choose a treatment modality.
Right, that's not real consent.
No, it requires interpreters, structured education from peers who have actually lived it, and clinicians who understand that the brain processing this information is fundamentally altered by the disease.
We have to actively support their agency.
Exactly, rather than just legally documenting their consent and moving on.
Well, we have covered a massive amount of ground today. For you listening, we've seen how chronic kidney disease and dialysis fundamentally alter the autonomic nervous system, basically crashing the body's internal sensors.
Yeah, it's a total system override.
We've explored how the toxins push outward, physically shrinking glands and breaching the skin's barrier. We've unpacked the devastating cascade of hormones that dismantle sexual health and intimacy. And we've zoomed out to see how the disease totally restructures a patient's sociocultural identity.
And if there's one core takeaway from all of these sources we've looked at, it is that recognizing this systemic alteration is the absolute prerequisite for holistic medicine.
We have to look at the whole picture.
We have to stop viewing nephrology as just replacing a single mechanical filter.
Yeah.
We really have to treat the entire human ecosystem that is desperately reacting to that failure.
Which leaves us with a lingering question about the future. If kidney failure systemically alters everything from our autonomic nerve impulses and skin structure to our most intimate relationships and social standing, what does that say about the trajectory of medical technology?
It's something we all need to be thinking about.
As we look forward, perhaps the end goal shouldn't just be building a smaller dialysis machine or a more efficient artificial filter. Perhaps the real frontier is figuring out how to artificially replace the silent, invisible ways our organs communicate with our brains, our hormones, and our sense of self. How do we rewrite the code in the smart house rather than just indefinitely mopping up the flood? Something for you to think about until next time.